Essentially, what I do um, consists of helping patients seek care in Cleveland clinics or in CC hubs around. So we're talking Ohio, Florida, London, Abu Dhabi, helping patients get seamless access to care. First of all, find out what kind of specialist the patient wants, right? And then you advise, right, where those specialists are. Maybe in London. A lot of patients prefer London because it's closer to Nigeria, obviously. But then, of course, main campus has a wider breadth. Depending on the subspecialty or the specialty required, you advise the patient, and the patient says, okay, let's try whichever works. And then you now contact GPS, and GPS has forms with which you onboard the patient, right? Once you onboard the patient, usually 1 or 2 times I have to get on the phone with GPS, agree, and then they register the patient. They find the specialist for the patient and then send the patient appointment letters. It's with that appointment letter that the patient knows that yes, it's now in the system, and then you can proceed to engage with whichever CC hub you've been selected to go to. Because we keep the physician so close to us, whenever there's a need for a follow-up, that physician calls immediately and says, there's a need for a follow-up. Patient comes to Ohio, gets a stent or a device, some form of pacemaker, right? He wants to follow up in London. I've had a case like that. He wants to follow up in London. So we have to keep, talking to the patient and say, so, and sometimes even remind that your follow-up in London is coming up. So you need to go get your blood work, check your device, and make sure everything is running okay. Just to look at the quantum of work that has gone on over the generations that makes up what we know as Cleveland Clinic today, you must share it with the world.